All right, so we're looking at more Medicare cases from around the country. Today we're going to take a look at another post. This one is titled "Denied Claim Revisited." It's like the Matrix. So I posted in May about getting a piece of paper from the lab testing company that I might be liable for about $650 if Medicare denied my claim. I had 2 lab orders done on the same day, one for my specialist for a chronic condition that I suffer from. The second was for my primary care doctor for a follow-up test and imagining imaging done to try and diagnose some dizziness spells I was having. Dizziness is a tough thing to diagnose a lot of times. There's so many different issues that can contribute to that. Both orders were made months before I went on Medicare, so that's a big clue. And I had both tests done on my very first day of Medicare, another big clue. The lab test for the specialist was approved. The other was denied by A, B, and G. So I'm assuming that's the plan that this person has. They have original Medicare with Medicare Part A for hospital, B for outpatient, and a supplemental Plan G, which is actually one of the most robust supplemental plans in terms of medical coverage. As routine tests, though, there were thyroid tests among others. The G provider and Medicare both say I owe over $1,000 for the second order. I contacted both to see if they would approve them. G said that I had to deal with Medicare. Medicare said I owe him $1,000. I posted about this situation in May. The suggestions were to wait and see if the claims will be approved. Here we are. I plan to call my primary care doctor to see if they will handle the appeal. They may be able to recode and test as necessary. Any advice? Okay, so a couple things here. Unfortunately, this is something that we do see every now and then. You get a denied claim from, even if you're on a really robust Medicare plan with a lot of flexibility, and it can be very frustrating. So in this case, 2 tests, one was approved, one was not. They were both provided before this person went on Medicare, and this person went to get the test the day that they were on Medicare. So a lot of coordination issues that could potentially happen. So definitely, before just paying the bill or throwing your hands up in the air, always investigate. So in this case, one of the issues that we see very commonly is simply it's a billing issue. So Medicare, in this case, the order was prescribed prior to this person going into Medicare. But if Medicare had received proper documentation as to why this test was necessary based on the codes, then oftentimes it'll go through, just like the specialist test that this person had on the same day that was also prescribed 2 months prior. So in this case, it's very likely that it is a billing coding issue, that the provider will need to bill it as something that's considered medically necessary by Medicare. So just a general test, unless it's a routine part of a routine physical, is typically not going to be covered from Medicare. So billing as is, doing an appeal. Unfortunately, with Medicare appeals, typically appeals are hard to get through unless there's a change in reason why something was prescribed. That can be really frustrating for providers, especially offices that are now, a lot of them are overwhelmed with patients and administrative costs have gone sky high. But in this case, most likely it is a billing issue. The primary care will need to look at the primary care's office will need to look at the billing code that they put in through Medicare and make sure that it is something that Medicare does cover, or be more specific in terms of why that was prescribed, and be able to resubmit that claim. So in this case, if Medicare denies the claim, then the supplemental plan will automatically deny it. So there's no reason why somebody with a denied Medicare claim should be going to their supplemental plan and saying, hey, can you reevaluate this? They're going to say, we're going to follow Medicare rules. As long as Medicare approves it, we'll approve it. If Medicare denies it, we'll deny it. So in this case, it's the absolutely right thing to do is to go to the primary care doctor that ordered the tests, have them reevaluate and resubmit to Medicare based on rules that Medicare will adhere to. So what happened with this case is that there was a happy ending, ended up that the provider did not provide a reason for, or not a valid reason for Medicare to approve the claim. They resubmitted it with the proper documentation. Looks like the claim went through, and the supplemental Plan G will cover the 20% that Medicare will not cover on an outpatient basis after his Part B deductible. So happy ending, but we see this very frequently, unfortunately, and it's because billing has gotten so complicated and things are always changing. And a lot of times this billing software doesn't update, or the person that's handling billing, there's so much turnover now in healthcare that people don't feel like they're getting the right training or have the right expertise to handle this level of complexity. So billing errors are a very common thing, and a lot of times the reason why something is denied is not because it was medically unnecessary or it was fraud, waste, or abuse. It was simply because it was not coded properly, somebody didn't provide the right documentation, or somebody didn't provide a referral or some type of prior authorization to make it work. We just had somebody, another story, friend of mine who ended up getting a very big surgery. It was over $230,000, and when she looked at the bill, she said her MRI was denied for this surgery. And it's like, well, they needed the MRI to diagnose what she needed to get done, and why was it denied? Well, it was denied because the practice didn't submit the MRI outside of a 48-hour, so they didn't submit it 48 hours prior to her needing the service. So she had booked the appointment like months in advance. It was just the person who was handling the billing didn't put it in until like 24 hours, like a day before her MRI, and because of that, it was denied because they didn't follow that 48-hour rule. So there are a lot of things like this that just, it's a lot of bureaucracy and a lot of different overly complicated systems that may not need to be there. So we see this a lot, and if you get a denied claim, don't panic. Happens all the time. First thing to do is talk to your doctor, talk to the billing office. Doctor might not know, probably won't know, and make sure that they've coded everything properly and to resubmit instead of going straight to the appeals process, because usually appeals, unfortunately, what we're seeing is that most of the appeals nowadays are being denied.